France has started to screen arrivals from China for COVID-19. It's the third EU country after Italy and Spain to introduce mandatory tests in recent days. They say the measures will help identify any new variants that emerge as China experiences a surge in cases. Well, the World Health Organization has said that it's hopeful that it will be able to officially declare an end to the COVID pandemic this year. But it's warning that there is still a danger of a new, more deadly variant emerging. So let's look at where we are after 3 years. Since the first outbreak in China at the end of 2019, nearly 6.7 million people have died of COVID-19. And even now, the virus still claims more than 1,500 lives a day worldwide. But that's way down on previous figures. Vaccinations largely protect people against severe disease, but the WHO says access to effective vaccines still remains very unequal. In many parts of the world, COVID restrictions have been eased as people learn to live with the virus rather than eliminate it. Well, here in Europe, northern Italy was the first region to see a rapid spread of coronavirus infections at the start of the pandemic and followed China's lead in locking down parts of the country. One city in particular, Bergamo, became a powerful warning sign to the rest of the world.
Back in early 2020, the coronavirus picked the northern Italian city of Bergamo as the place where it would cast its darkest shadow during the first wave of infections. For a time, Bergamo was the world's epicenter of the virus's deadly outbreak, leading to these haunting scenes. Bodies of the dead in army trucks being transported to crematoriums in neighboring regions. Inside Bergamo's hospitals, health workers battled to keep people alive.
I remember the sounds, yes, of the different devices that we were using at the time. Whistles, when you give a lot of gas, oxygen to the people, and also a kind of smell, something which I remember very well.
At the height of the crisis, Bergamo's hospitals did not have enough oxygen and intensive care beds. Consuelo Locati's 82-year-old father died just days after being admitted.
We discovered
from reading the medical record that the day after he was hospitalized, he was given the CPAP ventilation helmet. Unfortunately, at that time, there were not enough of those helmets, and doctors had to choose who could survive and who to let die. My dad suffered the choice to be accompanied to death.
COVID's wrath on Bergamo was fueled by a slow response by officials to detect the virus and enforce measures to contain its spread. A population of older adults with underlying conditions and a desperately under-resourced healthcare system that had suffered years of budget cuts.
We need to have doctors in the territory for generic purposes and also small healthcare places in the cities, in the territory.
Bergamo won't forget those that were taken away by COVID-19. This memorial is a tribute to them. Surrounded by a grove of trees, releasing the oxygen so many needed in their final moments.
More on this from Bodo Plachter, who's a virologist from Johannes Gutenberg University of Mainz. Welcome to DW. Virologists here in Europe are now talking about COVID becoming endemic rather than a pandemic. Could you just explain to us what that means?
Well, the situation is such that the numbers of new infections have been stabilized throughout Europe in the recent weeks despite the fact that restrictions have been lifted. So there is some sort of relief, but however you might call it, pandemic or endemic, the virus is not gone. It still causes a number of infections and also deaths. And so we have to watch the situation closely. And we have to remember that other viruses like flu or RS virus are now going up, leading to an increased rate of hospitalization and an increased workload for nurses and doctors who are already exhausted after the 3 years of pandemic. So we have to watch the situation.
Right. And part of that situation is China now reopening its borders. What's your view of those countries who are screening arrivals from China, which is seeing this surge of infections?
This is one measure they could take to identify variants, new variants which might occur, because a lot of virus is now circulating in China and other countries, possibly. So it's one measure, but we have to, of course, think of other measures like sequencing of these isolates then to really be able to quickly and swiftly identify new variants and to take appropriate measures afterwards.
And so why impose these against just China, since new variants can come from anywhere?
Yeah, that's true, but there's a lot of virus circulating in China, as we learn now. And the more virus is circulating, the higher the level or the chance for mutations and for new variants. And so wherever the virus is circulating at a high level, there's a chance for development of variants. And so we have to look into these countries who have a high circulation rate.
Right. And so you say that COVID spread, for the moment, has stabilized. Do you see it becoming something like, I don't know, like seasonal flu, which you mentioned, something that comes and goes and that we just live with?
Yeah, we have to live with corona, there's no doubt. And it's not clear how this will develop. It could be like a flu-like symptoms with severe cases occasionally seen. Could also be that it's just a common cold. We don't know yet, and nobody can know how that develops, but we have to live with corona.
Thank you so much. That's very clear. Virologist Bodo Plachter from Johannes Gutenberg University of Mainz.
Thank you.